Hello, welcome to the Communicable Research Podcast, and I'm your host, Andy Tattersall. I'm an open research communication specialist at the Sheffield Centre for Health and Related Research within the School of Medicine and Population Health at the University of Sheffield. And in this episode, we're going to talk about PACE, which is public and community engagement as part of mobilising health knowledge. And I'm joined by three colleagues who I'm collaborating with on an NIHR project on knowledge mobilisation. So I'm going to hand over to my three colleagues to introduce themselves, starting with you, Naeema, to say who you are.
Thank you, Andy. My name is Naeema Ahmed, and I'm the lead for the Public and Community Engagement, shortly PACE. I also work full-time with AFRUCA Safeguarding Children as a Senior Network Manager for the UK BME Anti-Slavery Network project.
Liz.
Thanks, I'm Liz Such, and I'm at the University of Nottingham, and I'm a McLaren Research Fellow and lead with the team the Knowledge for Public Health programme.
And my name is Joe Langley, and I'm a design engineer. I work for Lab for Living in Sheffield Hallam University, and on this programme of work, I'm nominally leading the deep co-production.
So, Joe, what does knowledge mobilisation mean for people who don't know, and particularly in this context around mobilising health research?
So in the context of this particular programme of work, knowledge mobilisation really refers to the efforts to get what we know from research and evidence closer to those that really need it and can use it. Obviously, there's lots of different facets to that. There's lots of different people who need and want and can use evidence. There's decision makers at national level and local authority level, and there's communities and there's professionals and practitioners. And they shouldn't be working in silos. So it's often about bringing them together to think about how research findings and evidence can be made most relevant and applicable to them in their context.
And Naeema, you're our PACE expert here at public and community engagement. What is PACE exactly? You know, people might think of things like public engagement, and this is different. What is PACE?
So PACE is simply, as you initially broke it down, is public and community engagement, and is the ability to be able to involve the very people who are closer to the subject matter of any research to be able to add their opinion, their views, and lived experience to it. And what we are doing as part of the Knowledge Mobilisation project is to ensure that the very people who are at the heart of the issues that matter most are able to bring their lived experience to it. And there's direct connectivity to the issues that we are looking at any point in time. So for us, that is PACE. The very people who are closer to the research, the very people who are closer to the knowledge that we want to be able to shed out there, we are bringing them at the center of designing of this whole project and for their voices to be heard at the end of the day.
And how does that differ specifically to such as PPIE, patient and public involvement, etc.? How does that differ from sort of PPI?
There isn't much difference, but for us is the intentionality to make sure that there is diversity and inclusion of ethnic minority groups. And as you said, there is PPI, there is PPIE. It's a matter of semantics. It's the name. So as far as there is an engagement of public, there is community. Whether you're using patient, it's just a matter of how do we involve the very people who are part of this. But for our project, we are making sure that the very communities whose voice are not always heard when it comes to research, we are bringing them as part of it. So we are very intentional about race, equality, diversity, and inclusion. At the same time, we are also very intentional about the connectivity to the very subject matter that we are looking at. And I know as we go on with this conversation, we will look at the various projects that we've been able to do so far. We've looked at a project from Kent and also a housing project. In it, when you look at the very subject matter or the very individuals who are at the bedside of these issues, we are looking at each and everyone who is connected to the problem that we are looking at. So the usual PPI, for example, if there is a research that is looking at diabetes patients or a research on diabetes or any other, the initial go-to is individuals who have diabetes or carers who are taking care of individuals who have diabetes. But they do not go a step further to look at the community of individuals who live around these individuals, whether it's within their communities, whether it's within any broader community, however you want to look at it. So we have that intentional connectivity of which organizations are taking care of these individuals within the very community that they live in. Again, I'm using diabetes as an example here. If we are looking at a broader scope of individuals who have diabetes, or there is a research on such individuals, how does it trickle down, or who are the very individuals who it has effects on? So that broader scope in that. And again, I've talked about the intentional aspect of ethnic minority communities whom on a normal day we wouldn't be bringing or hearing their voices in these conversations. So at the end of the day, that is the difference between our pace and the usual or traditional pace as it stands.
And it's very common for groups to work in silos, especially when you've got groups who actually should really be talking to each other. So when we think about people who are focused on PPIE and people like yourself with PACE, how much common ground communication is there, knowledge sharing between these groups? Because obviously very emerging, changing areas. And so how aware of each other are you?
I'm not a researcher. So from a research perspective, I'll leave it to Liz and Joe to talk about it, whether there is any research evidence to show if there's any connectivity or work between different PPIs and all that. But from my stance, or as an individual who coordinate PACE or public community engagement groups, there isn't much connectivity. I think we all work in silos. We are not sharing our experiences and knowledge at the end of the day. For example, if I'm recruiting individuals to be part of a specific engagement group, the learnings along the way, the kind of people that I'm bringing in, is it just going to stay with this project at the end of the day? How will we be able to share it with an individual who was able to bring together a typical traditional PPI and their learning curve so that we are able to do better? I think there isn't much evidence showing that. And I believe, again, Liz and Joe, from a research perspective, would be able to mention whether there is evidence or greater research to be able to probe whether there is that kind of co-production when it comes to PPIs in that. But I don't see it as it stands now.
I mean, I think PPI efforts have really improved dramatically, and there's been a greater push over the years for more diversity, more inclusive practice. I think there's been some great progress, but everyone seems to do their own thing in their own way, and there's quite a lot of fragmentation in the system of PPI or community engagement. So researchers, I don't know, I'm not particularly confident there's a really strong network of public and community involvement, researchers, people that specialise in it. There may be, because again, it's not really exactly my specific field, but there's definitely fragmentation in the system. So coordination would be great. I think there's been some sort of decent attempts of trying to do that with resources, bringing resources together, say through the National Institute for Health Research. But yeah, I think there's the fragmentation there and the coordination. There's probably some work we could do there.
I think it's a really interesting space. I'd agree, there's lots and lots of activity going on within the sort of research phase of knowledge creation. There's very, very little that we know of or is written and published about to do with what happens after research, when the phase that we're interested in, how you get that research and evidence out to people. So whether you call it implementation or knowledge mobilisation or whatever it is, there's very little that is published that we know about. So that's a really interesting gap that we're sort of working on and focusing on. But picking up on what Liz said, that bit where there is kind of really practices have grown and developed and enhanced in the sort of research phase, it is, I'd agree, it's really fragmented. There's lots and lots of different activity going on. And there's good reason for that to a certain extent, because if people do it well, then those efforts should be tailored to the people they're collaborating with in those specific projects. So there's a need for it to be really specific, context specific to each individual research project that's going on. But I think there is the fragmentation is about how you share good practices so that people can learn and borrow from those ideas. And that idea of building a community where we can be really open about borrowing ideas from, oh, someone tried that over there, we can try that because it's got similarities to what we're trying to do here, rather than having a sort of dogmatic kind of method, which I think could be inhibiting to genuine. So it's not about saying there is only one way to do it. That, I think, compromises or could potentially compromise efforts. So it creates a challenging space, how you kind of create some sort of framework and guidance, but flexibility within that that allows people to tailor it to the individual people and communities that they are collaborating with.
And it's worth stating that I think so far the whole research fraternity is catching on to the significance of having PACE as part of any research. It's just a matter of how do we do it better, or whom do we learn from, who has been able to kind of break any sort of barrier, and that is where we are to be able to coordinate. And I think Joe and Liz have been able to share that. It's just a matter of the next step to that.
Naeema, tell us about your role and the work you do for AFRUCA.
Okay. Before I talk about my role, maybe it's worth mentioning the organization that I work for and how they've been roped into this project. So AFRUCA Safeguarding Children is the parent organization that focuses on the safeguarding of children, but it also does quite extensive work when it comes to exploitation or focusing on ethnic minority communities and issues that do come around. And the project that I do work on is the UK BME Anti-Slavery Network, which is BASNet, and I'm the Senior Network Manager. In my role, I oversee policy, research, network development. And with BASNet, we do have quite an extensive network of BME-led charities that work within modern slavery and human trafficking. Working in that role kind of gave me the opportunity to be a social connector, kind of linking to so many charities and individuals who work across board. And their remit is quite extensive. They come with novel ideas, brilliant ideas when it comes to advocacy. And that, again, gives a lot of evidence and an interesting scope when it comes to my work, because I get the opportunity to learn from them and also be able to share my perspective in that. So, yeah, that is my role. With the PACE and our involvement with the knowledge mobilization is being able to use our social connectivity to be able to draw individuals from ethnic minority backgrounds to be able to make input or share their lived experience when it comes to this project. And that's why I'm being part of the knowledge mobilization project as a PACE lead in that. So that is AFRUCA, and that is my work, and that is what I bring on board in a broader perspective.
And it just sort of highlights, just to dip in there, the role of serendipity, I think, when it comes to developing collaborations that are focused on research. So we worked together in different capacities and gradually built up a relationship over time as people who work for different institutions. And I suppose my own learning from working with AFRUCA over a period of like 4 or 5 years now is the importance of that solid, trusting relationship, which is at the core of so much public engagement work, and learning together on our shared interests and how we can strengthen each other through our shared interests is, I think, fundamental to this partnership. And so I suppose in a very roundabout way, I'm just saying that I think good public and community engagement and involvement takes time and effort and relationship building and trust. Yeah.
I think at the center of it is trust, because there's so many people with lived experience, so many people who have something to say, they have something to share, but whom do they go to? Is a trusting source. Mm-hmm. And if you have any PACE, is a matter of the individual coordinating it is, would the person be trustworthy enough for them to be able to open up to, or even be able to say, yes, I want to be part of this. And that's will always be the missing link for anyone coordinating any kind of pace on a broader perspective. I also need to mention that Liz talked about relationship, and that kind of relationship is not always a one-way stream, is what is being brought to the table, and a collective relationship is not a one-sided relationship where one person keeps taking and asking and asking. It doesn't become a very healthy relationship. And I think the relationship between AFRUCA and the Knowledge Mobilisation Project is a shared and built relationship over time, infused in trust, and being able to know or having the bigger picture of collective good. At the end of the day, what do we want to be able to do for our community, and what do we want our community to be able to benefit from it? And that makes this a very beautiful relationship at the end of the day.
If I can just kind of come in on that, I think there's something that is perhaps really valuable to pick up on about the relationship and trust building side of things, and then your comment at the end about how that sort of enhances when you come within a project group, having that sort of sharing those relationships and trust and experiences and what each person brings across a group. So within projects, there's often one person sort of nominated as a PPI lead. And I think a danger of that is that a lot of the other stakeholders, sort of academic stakeholders perhaps, within these research initiatives that are set up in such a way, then sort of defer to that one person as the person who maintains the link and the relationship and the trust, and feel that it's not their responsibility. And that, I think, can become a sort of almost a disadvantage. Whereas if the person, the patient, the member of the public, the PACE representative, whoever that is, sort of brought more integrally into the centre of the project, and it's let's build these relationships and a kind of cross all of those different domains, and it's everyone's kind of duty, obligation, responsibility to welcome them and understand what they bring and share and learn from them, then I think that would be more, I don't know if there's probably some fancy word for it, like matrix something or other, I don't know. But can you understand what I'm saying? It's that when you have a nominated lead, I think that, that's their job, kind of becomes unconsciously a dangerous sort of side effect of doing that. And it's not to say their role isn't important, but I think it's a risk that perhaps we aren't looking at or aware of as much as we should be.
But I also think being a lead does not necessarily mean you carry all the burden at the end of the day. And I'll use being part of this project as an example. When we started putting together the PACE group, for now, we know that at the center of it, we wanted to be able to include all the 9 protected characteristics. But I also knew that as an individual, I have access to certain communities, but not others. And I remember having a conversation with Fiona. By the way, Fiona is part of this project, an amazing person who unfortunately wasn't able to be here today. And we had a conversation about how do we reach the Chinese community? How do we reach out to the disability community? I know what my strengths are, what I'll be able to bring to the table, but that does not necessarily mean that I'm a know-it-all. I don't know everything. So if, as part of PPI setups, individuals assume that if you have a PPI lead, that person is supposed to do everything, is a recipe for failure. And I also believe that within your network, Liz network, under your network will be vast. It's a matter of how do we harness our network to be able to bring individuals together for our collective good at the end of the day. And I think that will be the best approach for us to have a more successful coordination of any, whether we are calling it PACE or we're calling it PPI, is that kind of connectivity between us and harnessing our networks at the end of the day.
So Naeema, we appreciate the efforts and what you brought to this collaboration, and it's important that we've got you here. It's essential, it wouldn't work without you. And it might seem like a leading question, but how important do you actually think it is that we have more Naeemas working, bridging that gap between academia and, what can be done to actually facilitate that? And hopefully this recording is a way to actually make people think about that. But what more else could we do, and how important is it that we've got more people like you?
That's quite a tricky one, but I need to mention that the lead for our PACE is Debbie Ario, who is the CEO of AFRUCA, and I've been designated to be part of this project. So any sort of idea that we kind of bring on board, I bounce it off with her for us to be able to discuss and then be able to draw in. She has quite an extensive knowledge regarding this project, so I need to mention that. The other thing is everybody is unique, but at the end of the day, we all have unique strengths. I was very intentional when I used the word a social connector, but being a social connector also means that you are open-minded and you are availing yourself to learn. That whoever you're bringing to the table, you're not better than. They have something to offer. That's why you're bringing them in. So you're taking about 4 steps back to be able to learn from them, listen from them, and then have a more broader perspective of what is going on. So as to having somebody like myself, as I said, is a very, very tricky question. They're so, and I'm choosing my words very carefully here. There can always be one Naeema, but then 1,000 examples of Naeemas out there with specific skills and specific skill sets that can be harnessed given the opportunity. It's a matter of opportunity. Are you giving them the right opportunity? Are you giving them the right guidance so that they will be able to avail themselves and then bring the kind of skills that they have to the table at the end of the day? So I hope this helps.
And I think it goes back to what we were talking about earlier about silos, that if we've got different versions of Naeema, that they need to talk to each other as well as the academics. So you're all picking up that knowledge to support each other.
And then people, you'd be amazed the kind of knowledge individuals have if you give them the opportunity, or if you give them the ability to share what they want to share. So it's not having someone like Naeema, but if you are a project and you bring someone on board, are you giving the person, providing the platform for them to be able to thrive? Are you giving them the tools for them to be able to give you what you need? Are you not stifling their skills at the end of the day? So it's what you're giving them. You've seen something in them. You should be able to provide a platform for them to be able to thrive and then do better and then give you what exactly you want.
Joe?
I think there's something super interesting in what you were saying about people coming and learning and taking steps back, so they're always having that view that you can learn from someone. Because there's something, and I might be reading this all wrong, but there's something kind of inherently for me the opposite of what academia is set up to do. So people develop as these really specific experts in a really specific topic, and that's what they're interested in. They don't want to learn anything outside of that, just this thing, and they are the expert. So when they step into a thing, they're always coming with that kind of mindset. So they're never in that frame, that mindset of, I want to learn from these people about these things that I'm not interested in, these surrounding kind of topics, only kind of contribute. So they don't come to these things broadly. I'm generalising massively, and this might be kind of academia 10, 20 years ago, old-fashioned academia. It might not be contemporary academia. But there is, I think, something which inherently perhaps might be part of the problem in that academics are not really set up to do what you described. Which could be part of the problem.
This is a unique thing I learned from a journalist, that the best of journalists are those who assume they do not know, even though they know. That if you come from a perspective where you do not know, you ask the best of questions because you want to probe, you want to know. And for me, I think I've learned that for myself and in my own role, that again, I don't know everything, even though I may know, but I want to be at a place where whatever you are sharing with me, I have to be able to take something away from it. I shouldn't be the best speaker in the room or the best person with the best idea in the room. And that will always give you the opportunity to take that 4 steps back to give others the opportunity to share their views with you. So if you have, and I agree with you 100%, where you be in a room with a researcher, an expert in whatever communicable disease, and the person comes and just want to rattle what they want to share with you, it makes it difficult for you to probe other people, for other people to probe whatever you are saying, or for them to also share their lived experience with you. Because whatever you may be sharing may be coming from a theoretical perspective, but those whom you have to take that 4 steps back are telling you what they've lived with in that kind of interesting perspective. So for me, it's an interesting thing that I have to learn over the years, and it's been beneficial in that way. Yeah.
So Liz, on the other side, how do we make it easier or facilitate researchers and policymakers connecting with people like Naeema and AFRUCA? How, there has to be a two-way.
Yeah, sure. It'd be good to see some supportive infrastructure in there, and some pieces of some programs have that built in. So some of the NIHR programs have PPI specialists that generally tend to be located in universities, so don't have that community reach and perspective necessarily at fingertips, but then are able to develop these networks. So there are some good initiatives in place. I'm thinking of things like the first teams. They're usually a PPI lead with wide networks, but it is a challenge, and I think research groups might not find it easy to know what's happening in communities in terms of small community organisations, let alone like AFRUCA, Black-led charities and networks like BassNet that bring those charities together. So again, my experience is very much rests on those personal connections that have been made through research projects. So I don't have insights into particular infrastructures, but it would certainly be helpful. In some ways, what we're doing at NOPH might help us think and do things in a better way when it comes to understanding what local networks are and community organisations are, because we're working in co-production with local authorities who are very well connected to local community organisations. So there's an opportunity there that we should try and seek those connections. And as we're 1 year into the programme, those opportunities hopefully will come where we can create them, where we can connect our PPI, PACE infrastructure to the communities that have been served in local government. And we've been doing that in a kind of very flexible, pragmatic way as I've been working through this first year, but I can see that we've got potential for building that in the next couple of years.
We hear the term hard to reach when we are talking about communities. Academics often say, these hard to reach communities, it's become a bit of a trope in itself, really. And communities often, they're either overburdened, everyone just piles onto the same community again and again with very little kind of, should we say, exit strategy or sustainable or prolonged conversation going on, and many communities are just simply overlooked. Now, this is a failing of academia to actually understand that kind of communication, how to go into a community, what is needed, the investment, not just of time, but of money and effort, and actually making this something that is long-standing rather than just parachuting in and exiting at the first opportunity. What can be done to actually, first of all, let's get away from this conversation of hard-to-reach communities and actually look at the situation for what it is and actually bring together people in a more sustainable and understanding way as well.
So, yeah, I completely agree that hard to reach is incredibly flawed, and I think there's sort of other terms of hard to research, which again I don't like. It implies doing research too. I think people have begun to be more aware of this, and various different phrases have come about gradually. So talking more about under-supported communities, who are underserved. I still think this, in a sense, tries to remove the problem from an academic one to one that is within the community, and that it's inherently. So the first challenge, if someone always kind of, if someone says to me, well, they didn't understand, my challenge to them is always, perhaps you didn't explain it in a way that they could understand. And I think it's the communication is always about transmission and reception. And I think there's a huge filter on sort of the academic side, that transmission, they have just a kind of monoculture of how to transmit what they're doing and who to. And I think there's a lot of work, most of the work to overcome some of these challenges starts with how we transmit, and not how people receive. Yeah, that's an important part. Where they are, what they're doing, how busy they are, who's listening, where they're listening. All of those kind of things about channels and places and spaces are really important. But for academics, I think that's to be really critically aware of their own behaviours and practices, how they transmit their work, what the language they do, and the defaulting to lay English. I think there's just a get out of jail free card for many academics, because it's not about lay English. It's about finding the right. So it could be about visual storytelling. It could be about how you make it related. So again, it's the kind of headline messages. So most of the time, we're not interested in how you arrived at your findings, and we're not interested if you tell us what your findings is. Show, don't tell, show, or allow people to explore and come to their own conclusions. But the method is not important. It's like academics invest so much. It's so important to them about the credibility of what they found is how they found it. But that's not relevant to other people out there. So relevance is far more important than sort of methodological consistency or all those other things to do with scientific rigor. And yet that's the things that researchers are so invested in. So they've got to really completely rethink what it is they're trying to communicate, who they're trying to communicate to, where those audiences are, and think about this idea of something I've discussed with Ollie Williams, this idea of sort of evidence plus. So your evidence is a part of that, what you've found. But there's got to be, in terms of having a kind of dialogue and rhetoric, I think it's going to sound really academic now. Aristotle used those terms, logic, emotion, and ethical. So persuasion, power of persuasion. Academics are very good at having logical arguments, but they're not so good necessarily at the other two. And that's where you engage with people, where they're at. If you understand and you have empathy for their emotional experience and sort of the ethics and values that are invested in these things.
I thought that begins with listening then. So, so knowing how to restructure, communicate, put in a different language, transmit, whatever the term is, that's secondary to the listening first, isn't it? So listening to what people want from evidence, what people want to know about what this is trying to do. So the listening element is probably the first step, and probably one that traditional academic work might be even worse at doing in the first instance.
I agree with Joe. I don't believe there is any hard-to-reach community. It's a matter of approach and investment. What I would like to add is the cultural nuances when it comes to communities you want to reach out to. There are certain communities you need to invest in understanding them. How do I communicate? How do I reach out to them? How will they respond? And I can give you a typical example. If you want to reach out to the Ghanaian community, Ghanaians are very receptive, very open. In fact, you wouldn't even open your mouth and then they'll be serving you food and everything. Compared to the Vietnamese community or the Chinese community, which is a very, again, going back to the term which has been overused, a hard-to-reach community, we have not been able to study at length as to how do we approach the Chinese community so that they'll be able to open up to the broader community or have a broader conversation to us. They are more protective of what they have and what they want to share with you. Same with, say, the Indian community or most of the Asian communities, if you compare it that way. So if you're doing any kind of research and your primary focus is any of these Asian communities that have mentioned, it means that you need to invest in your approach in getting closer to them. And investing in your approach may not necessarily be you, the researcher, getting to know them. It may either be finding someone who is closer to them who will be able to lead the way. At the end of the day, is a relationship built on trust. Do they trust you enough to be able to open up to you? And the very issues that researchers probe, or the very issues that we kind of look at as sometimes very personal. And with any personal issue, you don't just want to knock on somebody's door and the person start blaring out to you, this is what I'm going through, and da. They need to be thinking about the consequences of what they are sharing with you. And the consequences will be that you sharing, the outcome of your research will be bringing a third eye into their communities, into their homes where they are going to be raided, or bringing immigration issues into their community. So again, they have to be very protective of the things that they are sharing with you. So it's all infused in cultural nuances and your approach, the implications of you getting to know that communities. And I think that is the kind of investment that is missing in our approach to the very communities that we want to be able to bring on board. Everybody, or again, from a research perspective, probably, again, I'm not a researcher, this is a disclaimer. I don't want to be held responsible for saying things that may not necessarily be. But again, I'm sharing this from a perspective where I've been able to interact with a lot of researchers and a lot of communities in that way, that the investment that we are putting out there, or the communities that we want to reach out to, are we just so fixated on what we want to hear from them? Or is there an added value? Because again, with any relationship, and I've said it earlier, it's a two-way stream. Is what are you bringing to me? Whatever I'm sharing with you, at the end of the day, what do I get out of it? Are you taking my information to be able to help do any good within my community? Or you're just taking my data, the information that I share with you to do best, to just go with your research, and that is all? And there is a follow-on problem for most researchers. As soon as the research is done, it's done.
Yeah, it's the exit kind of.
There is no proper exit plan where you've done a whole 4-year research within a particular community. You've been in their faces for God knows how long. You finish your project. You're not even sharing the outcome with the communities. You're rather sharing your outcomes with individuals that you respect more than the very communities that you've had a conversation with. Within a space of 4 years, do you think if another researcher comes, they're going to open up to such a person again? So traditional researchers have messed up the whole journey for new researchers who are coming in, who have just taken certain communities for granted. They take, and then that is it. But if you want to be able to do better, if you are asking, or if you're doing research, again, this is just an example. If you're doing research around immigration within an African community, pick any African country that you want to be able to probe. What exactly do you want to get out of them? And what do they also want to get out of you? Is there a particular problem that they want to solve? And would you be able to use your platform, your voice, to be able to help them whilst you're getting your information out of them? So that at the end of the day, it's a win-win situation. And when you're planning the exit strategy, you come back to feed back to them, the research that I did, this was the outcome. This is what happened. And then we move on from there. Until we are able to do that, we will continue having conversations of how to reach communities. But again, as I said, I don't believe in that. I don't believe in that approach, and it doesn't serve anybody better.
So in research, Naeema, there's so much of this about involving people across the research cycle, as if knowledge mobilisation and dissemination are part of that cycle. But shouldn't it be more, it's about an engagement cycle? So the building in of research, knowledge mobilisation, dissemination around the engagement cycle. So put the people in the middle and then build the research around it and the process of mobilising that afterwards. But it always seems to be the research in the centre, where sometimes you just chop the bits off at the end, like dissemination, or you ignore the bit about mobilising knowledge through the research cycle. We should have maybe a engagement cycle with the people in the middle.
This is like a fundamental paradigm shift in the way that research is thought about. So universities are very, in the UK at least, are quite keen on the ideas and terminology around civic roles and civic responsibilities in civic universities. And yet this idea that research should be a matter of community-based, community-situated activity that perhaps is almost driven and led by communities and people, and researchers are kind of working around that as a model. I mean, there are things, ideas that relate quite closely to that. There's things like research practice partnerships, which grew up in the States around education. But I think it does need a radical rethink and shift from funders, from universities, from all kind of parts of that system to that as an organisation on a systemic level, they need to take 4 steps back, as you were talking about earlier, not just researchers in those interactions, but the whole system needs to take 4 steps back and go, who are we doing this for and why? Let's put them at the centre and build a system around communities and doing research. And I guess these are the sorts of, we haven't been given the resources to create such a radical shift, but that's kind of what we're playing around with and exploring a little bit, hopefully, in this programme of work. I was really picking up on your points, Naeema, about the respect where they go and broadcast to the people that they respect before coming back. And I think that's such an important point about going back to those communities first, before you talk to any other kind of audience about your work. It's such a really simple indicator of where that respect lies. But I think we have to acknowledge there is a historical component to this. You mentioned it. Sort of older, more traditional researchers who have gone through these practices, and there's been hundreds of years of kind of evidence around research being done too. And unless we acknowledge that we're kind of working at a trust deficit already. So it's not just building trust from a kind of 0 point. We're trying to build trust from a negative, a deficit point with these communities. And that means there's a researcher from Northumbria, Teesside University, called Jagjit, who's been doing some work with Punjabi community. And she talks about how much of her time she invests in just going to community events and not to do research, just to be with and do things with. So they have community meals, and she doesn't ask any questions about research. She's just getting to that relationship building and trust building. And it's not the extractive, as soon as you get the opportunity, let's ask a research question. It's, no, let's just spend time with people and be with people. That's how you build those relationships.
And those sorts of things are very hard to convince funders.
Absolutely, yeah.
And could I, again, just chipping in this question, and if it's okay with you, from a research perspective, if researchers spend more time with their communities, wouldn't it be that their initial research questions could change? And will it be acceptable by funders, or from an ethics perspective or research perspective, will that be okay?
So I would absolutely say yes, the research questions are likely to change. I think it should be acceptable to those other parts of the system because it makes it more relevant research, and that's what research really should be about. I think that there are ways in which some elements of that system are currently set up which might make it slightly more awkward to have those kind of shifts or more emergent kind of approaches to research. But that's not insurmountable. I think where there is the will and desire and passion to do that, it's something that people can do.
Yeah, an example of that would be having more open or live protocols. I think, we've got not a live protocol, we have a reasonably open protocol for knowledge of public health. So if everything's very, tied and strict, then I suppose it could be problematic from the sort of administrative research point of view, but philosophically pretty sound position.
Ethically as well, I think there's, NIHR mandate a sort of steering group or advisory group. And I think there could be a more active role for them in terms of ongoing ethical review. So they get closer to the project, so they know more about what's going on. So judgments around what's being done from an ethical perspective, they've got more insight into what's going on than some other kind of ethics panel that might be down in Kent who just read a document and there's very little else. So I think that I'm not saying we don't need some kind of overarching kind of ethical oversight and approvals right at the start of a project, but thinking of ethics not as a procedural thing but as a practice-based thing, is that right? Yeah. Then sort of ethical refinements and reviews during the project can be perhaps done. That could be an additional role for those steering groups and advisory groups that are closer to the work.
So key to what you've been saying here is really infrastructure, with the issue of the tokenistic research, the researcher leaving the community. And unfortunately, the situation is obviously researchers do move on or they're just taken away into a different area of research. So to help that, there needs to be a greater infrastructure, and that's from those working with the communities in other capacities, the policymakers, local authorities, and this is obviously where we're trying to join those dots. And so if we were to sort of like have our wish list of things that would make this a whole lot better and more successful and sustainable, those people we will want in place. Also money, because obviously you need money to achieve this. What else do we need for that successful pace, initiative for that to get where it needs to be?
I think that's the word you used, Naeema, at the start. It has to be intentional knowledge mobilisation focus with a public and community input commitment at the centre of that. So the sort of shift in thinking that Joe was talking about, where we have to start to disrupt the dominant paradigms in the dominant way of doing things. I think it begins with building in those parts of what the expectation is. But that again depends on funders and it depends on the system. How things work still. But it has to be intentional, and there are some good signs in that direction around knowledge mobilisation in NIHR funding. It's now a requirement to have that consideration. But then, the question then becomes who's going to be doing this additional work, and do people feel confident, have the capacity and the skills, not just in doing, but the listening element that I was talking about before. So, in AFRUCA as an organisation, is there capacity for people to come to AFRUCA and ask questions and be able to access communities in the way that you facilitate for this programme, for this programme? Is there investment at that level? Because we're trying to build it by doing this, but it's a co-learning process. We're doing this together, and so we're building our own capacities, and AFRUCA building their capacities in this, two-way process. But it's a lot to ask of a system to just put it in as a requirement. Say, you must have knowledge mobilisation plans, and then it becomes like a procedural thing. How can it make it a meaningful thing? So the commitment has to be matched with an investment in the skills and capacities at all points in the knowledge mobilisation process. So if it's public health teams and local authorities, if it's community organisations, if it's in understanding what equality, diversity, inclusion looks like in knowledge mobilisation, that for researchers, then it's all of those things together, and actually is quite a big investment in a similar way to the PPI investment there was decades ago in clinical research. So, and we're still, finding our way with that. So, intentionality, commitment, got to be really core to it, aside from the resources, but that's integral to it as well.
If we were going to measure the impact of PACE, how would we measure it? What would those metrics be? I mean, I suppose this is how long's a piece of string. This is a evolving down the road. But if we were to try and measure it, is there any metrics or anything that we would want to apply?
this is really, really hard, really challenging question, and I think it's one we're probably going to have to leave as a question for the audience as well, and perhaps even if we can invite some feedback and thoughts on it. I think we between us probably have some ideas, but couldn't give you a really comprehensive answer. One for me, one simple thing that is to have something which asks those PACE members whether they have got out of it what they wanted out of it. So if each piece of work starts off with the setting of expectations and goals and so on from each different stakeholder, at the end of it, asking those stakeholders, did you get that thing out of it? And if not, why not? Or how far from that was it? There's something kind of could be quite simple about that. But that, and perhaps, again, thinking about the conversation we've had today about those things to do with relationships and trust, how have those relationships changed from start to end in terms of strength of relationship? And this has come up in another piece of work I've been doing with Annette Boaz, who a brilliant researcher down in London. There's often a kind of, within the literature, when people do make references to relationships in co-production, co-design, PACE kind of initiatives, it's always kind of quite a rosy tint. And actually, relationships even with families are quite often, fluctuate at best, shall we say? So, being aware of the fact that relationships fluctuate and we have to invest as much into repairing relationships as we do into building them. That is, for me, when we start to see that in literature and sort of metrics and measures of engagement, things didn't quite work out here, but we kind of did this process and rebuilt it and kind of re-established that trust. That, for me, would be a much bigger, stronger indicator of authentic kind of co-production, co-working with communities than any kind of shiny, glossy, woo, it's lovely, sort of stars and roses and everything. So I don't know. I'm going to ask Liz and Naeema to come in on this as well, because
from a PACE perspective, I think for our PACE members, for this to be impactful, I'm assuming if it will be for them to see their opinions or views come into fruition, that we shared this and we've seen it being part of the project, or we suggested this and it's been able to come out as an outcome. I think for them, that will be a huge success. It will mean that the whole project listened to them and then actioned on their views. So that is one. But I'll also like to mention that even with the No PH project and PACE, we're just scratching the face of it. We're just 1 year into the whole project. We haven't really explored the full potential of our PACE members. And we strongly believe there is more that we can do with them. There is more conversations that we can have with them. And there is more input that they can make into the project. At the end of the day, as I've said, is seeing that whatever idea, whatever input that they are making, we are making use of it. And that will be so beneficial at the end of the day. As to the PACE impact to the whole project, at the end of the day, I think, as Joe said, we will leave it to the listeners and we also leave it to our funders, right? So that they'll be able to come back to say, probably the PACE did really make a huge impact and this was able to come out of this, and we should be able to share our learnings with other people. So for that, we will leave it to the funders and then our listeners. But the last thing I also need to share is whatever our learning curve will be, probably is something that we need to take back and then explore. Will we have opportunities for us to be able to share our learnings with the wider community, so that in your earlier question when you asked whether is PPI, PACE, PPIE working in silos, we will be able to make a step towards it so that we are not working in silos. We are really sharing our learnings. And our initial learning now is we need to be intentional about our approach. We need to think beyond the initial subject matter regarding connectivity, who links to the initial subject matter. And will that make any difference? We are still learning around that. And will it be beneficial to any other project that is thinking of pace? That will be a feedback that we would like to hear from other people if they see our approach as worthy and worthy of emulating, moving forward.
So core to this work is about translating research, NIHR research, and getting it to policymakers, which then makes the change that it deserves to make into helping society. And one way we're doing that is turning this into human stories. And that's a great way to communicate health research, because we're all human. We all either have our own health issues or know people who have got health issues, whether that is a health issue or something, a wider determinant that is impacting their lives. So tell us about this work, Joe, in terms of what we're doing to translate and to tell these human stories.
So we're doing a number of different things, and I think our use of creative methods is really kind of central to this. Telling human stories through sort of visual means, films, storyboards, vignettes, I think is a really powerful way. It goes back to an earlier point I made about showing people rather than telling people. So most research in these kinds of spaces is really complex, sort of lots of interrelated. And the more it's kind of reduced into a set of summary bullet points, the more you lose that nuance and the complexity of the interrelatedness of these things. Stories allow us to maintain that. And rather than going, we did this research, we found X, Y, Z, it's here's a story of a person. And it's almost like spot the findings within the complexity of their lives and what's going on without, but these can be still, they're not kind of lengthy stories. They're kind of told through a small number of frames and key kind of words and phrases and text that fit underneath without over-labouring the tech side of it, I think is really important. And this you mentioned it's sort of the relatability, representation. You can do away with lots of the kind of descriptive text by showing those things in the images and in the films, rather than having a paragraph of text that says, these kind of populations or those populations or this people, that. It's there. You can just see it. And people engage with the content at an intellectual level, cognitively and perceptually. So in terms of consuming what's on the page and being able to understand it and interpret it, because it's not kind of laid out in kind of point by point by point, it's kind of inferred and implicit, and you have to kind of almost work it out for yourself. People start to engage with it at a slightly higher level, and that kind of understanding becomes more personal knowledge for them rather than the knowledge that the researcher has just asked me to accept. So I think there's that kind of the power of these in terms of the impact they have is about moving it from knowledge that the researcher or researchers hold to personal knowledge that the reader or the consumer user holds, and a far more nuanced understanding. And that understanding of not just the understanding of the impact on people and their lives. But I think within this piece of work, there's still lots of unknowns about that. So we don't know whether kind of visual storyboards is better than a film, or what works better for different communities or different kinds of evidence. So these are things that we still have many, many questions about. And we're playing around with that to a certain extent within this programme.
Oh, finally, we've talked about some of the issues, tokenism, working in silos, some of those sort of issues which we'd like to address, and we know that there's certain issues here that require lots and lots of different stakeholders to be involved for this to happen. But sort of looking forward, what do you sort of see and predict the future of PACE being, or what would you like to see on top of what we've already discussed in terms of moving PACE forward and embedding it more within research?
Well, embedding it in knowledge mobilisation, I think, is probably one of our core interests and goals. Like Joe said, I think at the beginning, there's a lot of activity. It's a requirement for public and community engagement, or PPI at least, at the beginning of research, during research, setting up research, and even in dissemination. I think it was, it's about 1 in 3 studies actually do involve PPI participants in NIHR research in the dissemination side, but even very few, I think 1 in 10 or something like that, in actual knowledge mobilisation or implementation. So that's the bit I'd like to see, and like to feel that when we come to the end of this programme that we were able to offer some innovations in mobilising knowledge with communities, alongside communities, with a focus on diversity, being intentional in that, and being able to share that among people who are interested. So having that, you talked about infrastructures, having something that is a supportive infrastructure for people that are interested in trying to get not just decision makers closer to evidence, but also get evidence closer to communities, communities closer to evidence.
To finish, you've summed up very, very much this group here, that we're all learning from each other. I think we all appreciate we don't know everything, and we're actually also willing to make mistakes. And I think that's been a valuable exercise, as a kind of a proof of concept of no PH, that we are all sort of taking this step by step and prepared to sort of push a few boundaries here and there, and actually make a few mistakes as part of this, because we believe in this, and hopefully this is a much further journey down the line. So I want to thank you all for your time today. It's been a very, very engaging conversation. Hopefully people listening or watching this will have actually learned a lot more about this, and obviously they can get in touch with us if they want to talk to us about this. So thank you.
Thanks, Andy.
Thanks, Andy.